So let's talk a little bit more about dentures. When you're missing all your teeth, the easiest and most traditional way of restoring that is to give you a set of complete dentures. However, dentures also present a large amount of problems. Most people don't have so much of an issue with the upper denture because there's a good amount of suction due to the palate being there. The main problem people face is with the lower denture because the presence of a tongue makes the denture a lot more mobile, it makes it a lot looser, and when food gets trapped under the denture while you're eating, it can begin to hurt as well. Fortunately, implants are able to help tremendously in that aspect. Implants can help to anchor your denture down by converting it to a snap-on kind of design. 2 or 4 implants can be placed, and the denture can now have something to hold on to, such that when you're eating and moving around, the denture doesn't keep popping out of your mouth. This can also help for upper dentures. If we have a good number of implants in them, we are able to convert the denture into a U-shaped design without a palate. This is often very helpful for patients with anatomical limitations like a large torus, or if patients have very bad gag reflexes. The fact that a palate is missing also helps you to be able to taste your food a little bit better because there are small taste buds on the palate which can be blocked by a regular complete denture. To go one step up from a complete denture, the next step is to place enough implants to get us an implant bridge that sits on the implants. In this way, the prosthesis is fully fixed in the mouth and it's the closest we get to regular teeth. If this sounds like what you're facing, feel free to give us a call. Come in for a consultation and we are able to talk to you a little bit more about what your options are and how we can go about giving you the kind of smile that you want.